These farm fires are now rising in Punjab. Of course, the delay is caused by the harvest season, which was delayed because of the flash floods. So, of course, multiple reasons there as well. But what really is the health impact? Because right now, we're in a desperate situation. We are in a public health emergency virtually, because these PM 2.5 pollutants actually penetrate your lungs and can even affect your kidney, your heart. And recent studies have actually told that there's a link between the PM 2.5 pollutants and brain illnesses as well. In fact, it can hamper your cognitive development. That is the level of health impact that we are currently witnessing. Of course, the immediate impact is that all of us are feeling this burning sensation. Our eyes are burning, chest pain, wheezing. These are the kind of symptoms we are reporting. And what is really the fallout, the health impact? I'm being joined by the medical director of LNJP, Dr. Suresh Kumar. So many thanks for taking time out and joining us on NDTV. What are you actually witnessing? Is there a very clear spike in the number of patients who are reporting and showing these symptoms related to air pollution? What are you witnessing at your hospital currently?
Absolutely. We have the very severe category. That AQI is between 400 and 500, and we see large number of patients coming to our emergency department, to our OPDs. The patient who have very bad lungs because of tuberculosis or because of smoking or because of the long COVID. Mostly these patients are coming to the emergency department. And we have seen that the children with asthmatic attacks, the female, those who are pregnant, they are also coming with the breathlessness, irritation in the eyes, sore throat, and uneasiness. So we have around 25 patients per day in last 24 hours, and today also we have many emergency visits, and the patients are coming in OPD as well as in the emergency department.
Absolutely. 25 patients per day showing symptoms related to pollution. Would you call this a public health emergency? What we are witnessing in the national capital, is it virtually a public health emergency?
Because already it's a severe category, very dangerous. That the recent ICMR study has shown that there is significant impact of this very bad air quality, not only on the lungs and airways, but even in the brain, in the cardiovascular system. These patients have very high blood pressure, they have the insomnia, they have the very poor quality of life. So this is evident that already we are dealing with the medical emergency, and this level of very high pollution is not acceptable. We have a lot of problems because of these PM 2.5 particles, PM10, the carbon monoxide, which is very toxic gas, then the carbon dioxide, sulfur dioxide, and other pollutants. So this is a very, very serious health issue.
Absolutely, and as you said, these PM 2.5 actually have a long-term impact as well. And what we are breathing essentially is a cocktail of poisons. You have, carbon, sulfate in the air, and it's a mix of toxic gases, as you said. And it's very important, viewers, here that the director of a government hospital is saying that this is a medical emergency. But talking about the long-term impact very quickly, Dr. Kumar, the cost is huge because this can hamper cognitive development, and in the long term, in the long run, pollution, of course, affects the quality of life as well.
Definitely, the quality of life is affected. Their cognitive functions, their behavior, their attitude. Most of these people are very irritable. They have no interest in the workplace, and a lot of not only the health issues or respiratory system issue, but the multi-system involvement. They have the multi-system involvement. They have the behavior problems. They have very poor quality of sleep. And there is a growth retardation also. In the long term, if we see that the growth retardation in the children is also a major impact, and those pregnant female, it affects very adversely the fetal outcome. So the effects are on the multiple levels at all the organs, and it is a very, very alarming situation.
And that, as you said, it is alarming indeed, because you also pointed out growth retardation, possible growth retardation that pollution can cause. Of course, it affects their life expectancy. Multiple studies have established that there's diseases like cancer that it can cause, antibiotic resistance. But very quickly, before I let you go, Dr. Kumar, my last question to you: what do we do? Because we are in a desperate situation. We are living in an emergency, and it's like going from one emergency to another. Given the fact that now you have Diwali and the situation is only expected to get worsen, what do we do? Is staying indoors the only solution?
This is a very important question, how we can prevent ourselves and our relatives, our neighborhood, because every time, every year, this problem is there around Diwali festival. And we have seen that there are multiple factors responsible for this pollution. So the most important and most effective method to prevent the airway injury is to use simple mask. You can use the mask, you can put the cloth on your face, and the outdoor activity should be prevented. The morning walk, evening walk should not be there, because you have the duration of exposure to bad air is directly proportional to the airway injury and the breathlessness. So minimum you have the exposure to the bad air, you are always better. So stay indoors, use mask, and you can use the steam, or you can use the inhalers if you have the tightness in the chest, or you have breathlessness, or your oxygen saturation go down. Then you must consult a doctor, a physician, or a child specialist, because it's very important. You should not neglect if you have a very severe respiratory distress. So this, once you have the breathlessness, you must visit the doctor.
Absolutely, Doctor. Thanks so much for joining us on NDTV. Of course, as you said, it's an alarming situation. Staying indoors is the only solution. And as Doctor is pointing out there, if you report these symptoms, then you must consult a doctor as well, because this is not something that you can take lightly. But as we reported earlier as well, this is not just a Delhi NCR problem, it's a North India problem. In fact, in Mumbai as well, alarming levels of pollution. Of course, lower than Delhi, but the fact of the matter is that for Mumbai, and as per the standards of Mumbai, as per the standards of the maximum city, the levels of pollution are indeed alarming. In fact, just a few days back, in fact 2 days back, we had this report where Mumbai was also among the 5 most polluted cities in the world, and that is extremely concerning. The AQI is in the moderate category. In some parts of Mumbai, it's also touched the poor category, which is extremely rare, because we also have to look at it in perspective, because generally these levels of pollution are reported closer to Diwali, but this time, much ahead of Diwali, we have these levels of pollution which are only expected to get worsen in the days to come.